Hey, future nurses, welcome back.
Yeah.
You know we love to take these deep dives, and today we're looking at something that you will be seeing a lot in your careers.
Oh, yeah, for sure.
We're talking about pulmonary function tests, or
Yeah.
PFTs.
Yeah, PFTs, they're like detective work for the lungs.
I like that.
We're going to be figuring out what's going on with the patient's breathing, how well their lungs are working, and we've got some excerpts from medical texts and presentations to help us break this all down.
Perfect.
So, what's so cool about PFTs is that they give us objective measurements. It's not just a patient saying, like, oh, I feel a little short of breath.
Yeah.
These tests can really show us, how much air the lungs can hold,
Right.
how fast it moves in and out, and even how well oxygen is getting into the blood.
So it's not just about taking a deep breath.
No.
It's about what's happening, like, at a deeper level, right?
Exactly.
Like, are the lungs themselves stiff? Are the airways narrowed? PFTs give us those clues.
You got it. And for you as nurses, understanding PFTs is about more than just knowing the procedure.
Yeah.
It's about being able to advocate for your patients,
Right.
If you see a certain result, you know what follow-up questions to ask the doctor,
Oh, interesting.
what kind of care the patient might need. It really elevates your expertise.
That makes a lot of sense.
Yeah.
Okay, so let's start with, I think, the most common one, spirometry.
Okay.
It sounds kind of intimidating,
Yeah.
but think of it like this. We're measuring the patient's breath like it's an athlete in a race.
I love that.
Yeah.
Yeah, so we've got the forced vital capacity, or SVC. That's like the total distance the runner covers, right? It's the total amount of air they can forcefully exhale after a big inhale.
Okay, and then there's the FEV1,
Yes.
force expiratory volume in 1 second. So that's our runner's burst of speed at the start.
Exactly.
How much air they can exhale in that first second.
And that ratio between FEV1 and FVC, that's going to be our clue to what kind of lung problem we might be dealing with.
Okay, so like if someone's FEV1 is low compared to their FVC, it means they can't blow the air out quickly.
Right.
Like something is blocking those airways.
Exactly.
That's our obstructive pattern, right? Think asthma, COPD.
You got it.
Yeah.
But then if their FVC is low overall, even if they exhale that smaller amount quickly, it suggests that their lungs just can't hold much air to begin with.
Interesting.
That's restrictive. So like pulmonary fibrosis, making the lungs stiff.
Okay. So just from those two numbers, we're already getting a sense of what's happening inside.
Yeah.
That's amazing.
Yeah.
Now, I know as nursing students, you will be hands-on with these tests. So what are some things that you should be thinking about before even starting spirometry with a patient?
Okay, well, first of all, those doctor's orders are your Bible.
Right.
You have to make sure you understand what type of spirometry is ordered.
Okay.
Are there any special instructions? Sometimes there might be specific things the doctor needs to see, or the patient has a condition that changes how we do the test.
Got it.
Got it.
Okay. So making sure we're getting the most accurate results possible.
Exactly.
Okay. And then there's the patient themselves, right?
Yes,
They might be nervous. They might be unsure of what to expect.
absolutely. This is where your nursing skills really shine.
Right.
You're not just operating a machine.
Mm-hmm.
You're putting the patient at ease.
Yeah.
Explain what the test is for, what they'll be doing, and why it's important. Make sure they followed any instructions, like avoiding certain meds or caffeine beforehand.
Because a cup of coffee before a spirometry test could really throw things off, huh?
Oh, you wouldn't believe the things that can interfere with results. And before you even start the test, always get those baseline vitals. Heart rate, blood pressure, all that.
Yeah.
Crucial for comparison later on.
Okay. So now imagine you're in the room with the patient. Spirometry machine is ready to go.
Okay.
What are some key things to do during the test itself?
Clear instructions are key. You are demonstrating how to breathe into the mouthpiece, reminding them to inhale deeply, then exhale as hard and fast as they can until their lungs are completely empty.
I bet that takes some coaching.
Yeah.
I'd probably get tired blowing out that hard.
You'd be surprised.
Yeah.
Sometimes people stop too soon or they don't get a full breath in. So you might need to do some practice runs and just be super encouraging.
Yeah.
You're also their watchdog,
Right.
making sure they don't get dizzy or lightheaded from all that forceful breathing.
Yeah.
Watch their color, their breathing pattern, their heart rate. If anything seems off, pause the test and make sure they're okay. And document everything carefully, how well they performed, any issues, any coaching you provided.
Right. Because those details can really help the doctor interpret the results.
Exactly.
Okay. So let's say the spirometry is done.
Yeah.
The patient did great. You documented everything like a pro. What happens next?
Now it's time to analyze those results and help the patient understand what they mean. You'll be explaining, what those FE1 and FVC numbers are, what that crucial ratio tells us.
But you're not just throwing numbers at them, right?
Right,
It's
exactly.
about making it relevant to their situation.
Right. If it's an obstructive pattern, you might say something like, your results show that you have some narrowing in your airways, which makes it harder to exhale quickly.
Hmm.
This is common in conditions like asthma or COPD, so the doctor might suggest some medications to help open up those airways.
Okay. And if it's restrictive?
Then you'd explain that their lungs just can't hold as much air, maybe due to stiffness or scarring. That helps them understand why they might be feeling short of breath.
Got it.
And of course, always document everything thoroughly. The results, any symptoms they had during or after the test, any interventions you provided.
So that's spirometry, a key tool in your nursing toolkit. It's amazing how much information we can get from just a few breaths.
And remember, this is just the beginning. We've got a whole lineup of PFTs to explore, each giving us a unique piece of the puzzle when it comes to lung health.
I'm ready to dive deeper. What other fascinating tests await us in this deep dive into pulmonary function?
Well, next up are lung volume tests,
Okay.
which tell us even more about the capacity of those lung balloons we talked about. Lung volume tests are especially helpful when we're talking about diagnosing those restrictive lung diseases where the lungs just can't expand as much as they should.
So we're not just looking at how fast the air moves in and out.
Right.
We're looking at how much air the lungs can actually hold overall.
Exactly. Think of it this way, if spirometry is like measuring the flow of water in a pipe, lung volume tests are measuring the size of the tank the water is flowing into.
Okay.
Yeah.
I love that analogy. Okay, so what are the key lung volumes that we're measuring here?
There are three main ones. So first we have total lung capacity, or TLC.
Okay.
And as you might guess, this is the total amount of air your lungs can hold after taking the deepest breath possible.
So it's like measuring the maximum capacity of that water tank that you mentioned.
Precisely. Then we have residual volume, or RV. And this is the air that's left in your lungs even after you've exhaled as much as you possibly can. Kind of like the little bit of water that always stays at the bottom of the tank, no matter how much you drain it.
Interesting. So even when we think we've breathed out all the air, there's still some just hanging out in there?
Exactly. And finally, we have functional residual capacity, or FRC.
Hmm.
And this is the amount of air left in your lungs after a normal exhale, not a forced one like in spirometry. So it's like the normal water level in the tank when it's just sitting there.
Okay, I think I'm getting the hang of these different volumes. Now, how do we actually measure these? Is it the same mouthpiece setup as spirometry?
Some lung volume tests can be done with a similar setup, but others require the patient to sit inside a sealed chamber called a body plethysmograph.
Okay, a sealed chamber. That sounds a little intense.
It is. It's like a big, clear phone booth. And it actually measures changes in pressure as the patient breathes in and out. Oh, wow. It might feel a little strange at first, but it's a safe and effective way to get really precise measurements, especially for that residual volume we talked about.
Okay, so for nursing students who are about to assist with a lung volume test, what are some key things to do beforehand?
Okay, well, just like with spirometry, you always start by reviewing those doctor's orders.
Of course.
Make sure you understand what type of lung volume test is being ordered, are there any specific instructions, and then it's all about patient preparation.
Right, because I imagine being in that sealed chamber could be like a bit claustrophobic for some people.
Exactly. You'll want to explain the procedure clearly, emphasize that they'll be safe and comfortable inside the chamber,
Okay.
reassure them that you'll be right there with them the whole time, and that they can stop the test at any point if they feel uncomfortable.
And of course, just like with spirometry, we need to make sure they haven't had any caffeine or smoked recently and get those baseline vital signs.
Absolutely. Now, once the test is underway, what do you think are some key things for nurses to keep in mind during the lung volume test?
Well, I imagine clear instructions are still super important, especially if they're in that plethysmograph.
You got it. You'll be guiding them through different breathing maneuvers, making sure they follow instructions carefully, and encouraging them to relax and stay calm.
Right. And we're still being those patient advocates, right? Watching for any signs of distress, anxiety, discomfort, difficulty breathing.
Exactly. And of course, meticulous documentation is key, just like with every other test.
Okay, so the lung volume test is done, the patient did great, and everything is documented. What happens next?
Well, now we move into the post-test phase,
Yeah.
which should be starting to sound familiar by now.
Right. Assess their response, provide education on the results, document everything. Is there anything unique to lung volume tests that nursing students should keep in mind during this phase?
Yeah, one key thing to remember is that lung volume test results are especially helpful in differentiating between obstructive and restrictive patterns.
Okay.
So when you're explaining those results to the patient, focus on those key differences.
Okay, so if their total lung capacity is low, we might explain that this suggests that their lungs aren't able to hold as much air as they should,
Right.
which could be due to like stiffness or scarring, which points toward a restrictive pattern.
Exactly. And if the residual volume is high, we might explain that this means they have more air trapped in their lungs than usual, which could be due to narrowed airways, suggesting an obstructive pattern.
Got it. And just like with spirometry, we'll need to relate those findings back to their specific condition and explain what it means for their treatment plan.
Right. So, for example, if the lung volume test results support a diagnosis of pulmonary fibrosis, a restrictive lung disease, you might explain that this means that the lungs are becoming stiff and scarred, making it harder to take deep breaths.
And you can explain that while there's no cure for pulmonary fibrosis, there are treatments that can help slow the progression of the disease and manage symptoms.
And of course, as always, you'll want to document those results meticulously, along with any patient symptoms, interventions, and education provided.
Okay, that makes sense.
Okay.
So we've covered spirometry and lung volume tests. What other exciting PFTs await us in this deep dive?
Next up is the diffusion capacity test, or DLCO, which is a bit different from the others in that it measures how efficiently oxygen actually crosses from the tiny air sacs in your lungs into your bloodstream.
Oh, that's interesting. So it's not just about how much air you can breathe in and out, but how well your body is actually able to use that oxygen.
Exactly. And the DLCO test can be really valuable in diagnosing and monitoring conditions that affect that crucial gas exchange process.
So it really is about making sure that we're understanding that patient in front of us,
Exactly.
not just looking at a sheet of numbers.
It's putting all those pieces together.
Right. And you were talking about how sometimes the numbers might not add up with how the patient says they're feeling.
Exactly.
Can you talk a little bit more about that?
Yeah, so, somebody could have a decent FEV1, but still be, really gasping for air when they walk up a flight of stairs. Or they might have a, reduced DLCO, but not really be experiencing any noticeable symptoms.
So how do we kind of reconcile those discrepancies?
It's a good question. And as nurses, you're really going to be using those critical thinking skills.
Right.
You're looking at all those clues, piecing them together like a detective, right?
Yeah.
Asking yourself, does this make sense?
Yeah.
Are there other factors at play? What additional information do I need?
And then advocating for that patient. Right.
Exactly.
Going to the doctor saying, hey, I'm seeing this. What do you think? Or can we do further testing?
Exactly. You're their champion.
Yeah.
You're making sure that their voice is heard, that they're not just a number on a chart.
Right. I'm really starting to see how much responsibility nurses have when it comes to PFTs.
Yeah.
It goes way beyond just administering the test.
It does. Your educators, your advocates, your detectives, all rolled into one.
That's amazing.
Yeah.
Okay, so we've talked about the tests themselves. We've talked about the clinical significance. We've talked about the patient perspective. Before we wrap up this deep dive, what final piece of advice do you have for nursing students when it comes to respiratory care in general?
Don't underestimate the power of prevention.
Oh, why?
I mean, yes, PFTs are really crucial for diagnosing and managing existing conditions,
Yeah.
but there's so much that we can do to help people protect their lungs in the first place.
So those healthy lifestyle choices we've all heard a million times actually matter.
More than you know. Encourage your patients to quit smoking. It's never too late to make that change. Talk to them about maintaining a healthy weight, getting regular exercise.
Yeah. Yeah.
It all adds up.
What about environmental factors? Avoiding secondhand smoke, minimizing allergens, things like that.
All important. Even things like wearing a mask if you work around dust or fumes. These might seem like small things, but they can have a huge impact on lung health over time.
So future nurses, as you head out into the world, remember that PFTs are just one tool in your arsenal. Combine that knowledge with your critical thinking skills, your empathy, and your passion for patient care, and you'll be amazing advocates for respiratory health.
I love that. Couldn't have said it better myself.
Awesome. Well, thanks for taking this deep dive with us.
It's been my pleasure.
Until next time, keep breathing easy.